Jane Morgan, former executive director of the COVID task force at Piedmont Healthcare. She's also our Healthy Morning contributor. Good morning to you, Dr. Morgan. Always good to see you.
Alex.
Is it just me, or am I hearing a lot of COVID cases starting to pick back up, or did I just kind of black things out for the last few months?
It's not just you.
Okay.
We all now have people in our social circles who have COVID, and it's starting to not only uptick, we see it in hospitalizations as well. Hospitalizations have more than doubled since the 4th of July. Now, nowhere near where we were at our peak,
right,
but still, that's pretty rapid. In 2 weeks, we've seen hospitalizations double. And remember, that's one of the only metrics that we're tracking now, hospitalizations and wastewater.
Got it. So for President Biden, I mean, he's in his 80s. How concerning is it when someone in their 80s gets COVID?
Right, two things. It's very concerning when we see an elderly person get this type of virus. However, these are milder variants. And the other thing we have to consider with President Biden is he has world-class access to health care. And so when you have that kind of access to health care, you really are going to get top level. And so we know not only has he been boosted and he's got an updated vaccine, he probably received antiviral therapy right away and is resting fairly comfortably.
That was gonna be my next question, because like you said, he is vaccinated and boosted. So what do you say to that person out there who may be over 65 and says, hey, I'm doing everything I can, and this thing still got me and I don't know what else to do?
Yeah, so remember, the vaccines can reduce your risk of getting an infection, but they don't prevent it. What they really do is reduce your symptoms such that you can stay out of the hospital, such that you can recover at home and be fairly comfortable. And so that's really where we are with the vaccines. It's really important for people over the age of 70, over the age of 75, people who are immunocompromised, heart disease, chronic medical conditions, because this virus, even though these flirt variants are still mild, people with those types of medical conditions can find themselves in a severe situation very, very quickly.
So really quick, if you do get COVID, are we still in that isolation time period? I mean, I know like the rules and it's all kind of changed.
Great question, Alex. Super confusing. But a few months ago, the CDC did drop that guidance. And now what you should do is self-isolate until your fever disappears for 24 hours and symptoms are reducing. After that, wear a mask if you're in close contact with people for the next 5 days.
All right. Thank you so much, Dr. Morgan.
You're
Always
welcome.
good to see you. We are going to take a quick break, but we'll be back after this.